let's talk scarring in patients of color. I think being a person of color myself, I get so many patients of color, like men and women. And one of the number one concerns is how am I going to scar? I think depending on someone's ethnicity and background, there are certain kind of generalizations we can make, but it's really important to me to kind of identify their personal own history of scarring and take all of those factors into consideration. So if someone tells me they have a history of keloiding, I know I'm going to make certain changes or take certain steps in addition to what I might recommend to somebody who has no history of that scarring. And I think the key in this is that we work together, like the surgeon and the patient, because there are things I can do, and then there's things I need you to help with after surgery to kind of set yourself up for the best scarring. The genetics like that you have, neither of us can control at this point, but what we can do is control how we're kind of guiding the scar to the best healing. Because at the end, I want it to have as little visibility as possible. So I will do things in the surgical design and the technique that I'm using that kind of minimize the chances of creating more inflammation than there needs to be just for regular healing. Obviously, inflammation is part of wound healing, but if I can use sutures to minimize that, if I can avoid using things like steri strips, which for some patients, like the scar heals beautifully, but now they have a mark from where that tape was. So these are things that in patients of color are even more important to kind of be aware of and avoid if we can. Also, things that I have you do after surgery in terms of what you're using on the scar, like they do make a difference. Time also makes a difference. With time, these tend to get better. But if we can do active measures early on, I feel like it helps minimize that visibility. Also, a little further out after the scar gel and the maybe silicone tape or other things we're doing, I'll also recommend microneedling or other types of skin resurfacing that can safely erase or help erase that scar, but things that are safe in skin of color because not everything will be. So I kind of do a tailored approach to that patient and their skin type.